Hello everyone, welcome to MediSNAPS, Completing Healthcare. This video is a complete guidance for the parents on the current COVID situation. This series is brought to you by in collaboration with babyhelp.in. Today we have with us a very special guest, Dr.Sandip Gupta, who's a senior pediatrician and a child care expert in Bangalore. A very warm welcome to you, sir. Following questions are: if a lactating mother is a COVID positive, should she continue breastfeeding, and if yes, sir, how?
Many of the mothers who are actually having newborn babies or young babies, they are becoming corona positive, and I am getting multiple calls about whether they can breastfeed the baby if they turn COVID positive or they are suspected to be COVID positive. What is happening is the adults in the family are becoming COVID positive and mother is definitely coming in touch with other people. So they are suspected to be COVID positive, or they are getting mild symptoms of COVID, but they are not tested, or they have tested and become corona positive. In that case, there is a big confusion among the mothers whether they should continue with the breastfeeding or not. So to answer the question is, because breastfeeding has multiple advantages and it is actually a life-saving thing for babies, WHO and CDC at different timings have recommended. So CDC had recommended breastfeeding in COVID positive mother in December 2020, and WHO has recommended the same in update in 2021 in May. So both the major authorities have actually recommended that breastfeeding can be continued even if the mother is positive. The reason for this is they have seen that the transmission of the virus, the COVID virus, is not happening through the breast milk. So breast milk does not carry the virus from mother's milk to the baby. So it is not coming in the mother's milk. So virus is not coming. Even if the mother is positive, the virus is not getting into the breast milk. So there is no risk through the milk per se. So what is happening is, when the mother is feeding the baby, she is coming in close contact with the baby. So there is always a risk of transmission from mother to baby through the breathing, through the aerosols. So what is recommended is, whenever you are doing breastfeeding and you are suspected COVID positive or actually COVID positive, then as a mother you should wear mask. And like I said before, you can do it as a double mask. So wear double mask, and if you are COVID positive, you may consider wearing a N95 mask and a cloth mask on top of that. Actually, especially when you are doing the breastfeeding. So during the time when you are doing breastfeeding, 15 to 20 minutes, that time you can wear double mask and include an N95 mask to prevent the infection to going to the baby. The other thing which you need to follow is wash hands. So if you are COVID positive or suspected to be COVID positive, then wash hands every time 20 seconds with a soap and water before touching your baby. The alternative for hand washing is sanitizer. So you try to maintain the hand hygiene to prevent infection going to your baby. And third thing is, clean the surface areas.
Thank you so much, sir, for the lovely information. Do check Dr. Sandip Gupta's website and social media handlings. The link is in the description for any further queries. And do like, share and subscribe to our YouTube channel, and don't forget to hit the bell icon for any further updates.